Good day and welcome to Psych Sense, where we make sense of mental health. I'm Ken Mallon, your host, and today we're going to talk about electroconvulsive therapy, also known as ECT. Now you may know this by its former name, electroshock therapy, or just plain shock therapy. This treatment has a negative connotation in the US, largely due to its early history and depiction in movies, so I wanted to explain more about what it is. Specifically, I'll talk about how we think it works scientifically, who it works for, and some details on what exactly happens during the treatment. First of all, what is it? Now, ECT is a treatment in which electricity is applied to the brain to induce a seizure to provide relief from severe mental illness. And guess what? Modern ECT is extremely effective. For example, in those people with major depressive disorder, in particular, in those where nothing else seems to work, 50% get better. Think about it. These are people who have gotten nothing out of therapy and medications. They've tried absolutely everything. Now they try ECT and half of them get better. That's amazing. That's a highly efficacious treatment. Now we don't completely understand how it works, but by studying the brain via imaging techniques before and after ECT, looking at people for whom it worked and those for whom it didn't, two major patterns do emerge about how this works. First, ECT has what we call an anti-convulsive effect. It basically quiets certain parts of the brain. It reduces the excess firing of neurons, and we can see this in imaging tests. Secondly, for other parts of the brain, we observe what we call a neurotrophic effect. This means it causes cell growth in some areas of the brain. So ECT directly changes brain activity levels and nerve growth. Now, in addition to major depressive disorder, this treatment has been shown to be effective for those with schizophrenia, severe mania, and catatonia. Now, catatonia is where a person has motor stiffness and what we call stupor, where someone's in a state of semi-consciousness and has very poor cognitive response. Now, let me describe the treatment itself. A patient comes in the treatment room, they lie down. Sometimes a rubber mouthpiece is placed in the patient's mouth to prevent lip biting, biting of the tongue, etc. And they're given a general anesthesia plus a muscle relaxant, and they basically go to sleep. Now, electrodes are then placed on the scalp, and current is delivered either bilaterally or unilaterally, meaning that it goes through both the right and left hemispheres or just one. The treating physician decides in advance the amount of current, the placement of the electrodes, and if they're going to go for one or two hemispheres. They make a judgment call on the amount of brief pulse current to apply based on age, gender, and their experience working with similar individuals. They start low and see what happens. Remember, they're trying to induce a mild seizure. When the seizure occurs, the patient will shake, which certainly looks scary, but you have to understand that this is a seizure taking place under very controlled medical conditions, and the patient feels and remembers nothing. When the patient wakes up, they will often be a little confused at first, but you see this generally with general anesthesia. But one of the things going on here is that one of the major side effects is retrograde memory loss. And this is where parts of the typically very recent past is lost. It's not uncommon for the patient to not remember coming to the clinic or being in the treatment room. And sometimes these memories come back, sometimes not. Some patients have more memory loss and some have little to no memory loss. So there is some variability, but we do know that this does have the side effect of retrograde memory loss. Now, this procedure isn't done with just one treatment. The patient will actually come in 2 to 3 times per week until the psychological symptoms go away or until it becomes clear that it's just not going to work. So the bottom line here is that ECT is not what you might remember from movies such as One Flew Over the Cuckoo's Nest. In fact, modern ECT is conducted very humanely and ethically while the patient is unconscious, and it can be extremely effective among those who have failed other forms of treatment. And in a prior video, I talked about severe mental illness and the effects on longevity. This is another video about severe mental illness. So a severe mental illness can be very effectively treated with ECT. With that, thank you for watching Psych Sense, where we make sense of mental health. I'm Ken Mallon, your host, and I'll see you next time.